Hello, everyone. Good evening. It's Thursday again, and here I am again, your NCLEX coach, Mr. Alan Matus, and thank you very much for being here tonight. We're gonna have some questions again on nursing prioritization and delegation for tonight. So, everybody, welcome, and I'm so happy that you're all here. I hope that you will learn again the principles on how to answer these types of questions. So far, I keep hearing from students that they are really very happy and they've been passing the NCLEX. And one of the things that they really say is that this session that we do every Thursday, Pacific time from 7 to 8 p.m. Is really helping them. So one of the most important questions in the NCLEX that students are really having a problem with is the prioritization and delegation of nursing care. And I hope that in my own little way, I'm helping all of you overcome this most important type of questions in the NCLEX. But before anything else, I would like to welcome some people for tonight. We're gonna have, so we have Hilda. So hello tonight. Okay, so nice for being here. And also we have Caroline. Okay, nice to see you here tonight also. If you could also put in the comment section where you're coming from. So we are international. This is worldwide. So it's nice to see you all and to have that reach of different students from different parts of the globe. So tell me, are you in California? Are you in New Jersey? Are you in the East Coast, West Coast? Are you in another country right now, or what continent? So that would be very exciting to know where my audience is coming from tonight. Okay, so I have prepared several questions for tonight, and I'm so excited because these are really very nice questions for tonight. Okay, so all right, so we have so from Florida we have Denise Germain. Okay, nice to see you here tonight, Denise. All right, so we also have from Nevada, that would be Rich Mackie. Nice for being here tonight also. Thank you. And then also we have Amy. So Amy is from Los Angeles, California. So nice to see you here tonight. And then we have from another country, and that's from the Philippines. So Angeli. So Angeli, thank you for being here tonight as well. I hope that you will find our session very helpful for tonight. And again, we have from Florida, we have Matthew Rodriguez. He's from Florida. Okay, so we have international students all over the place. So also, Alan Hill Torres. Now, he's our new student right now in the I think it's Gian, right? So Gian Abregas, I guess. You're our student in the online NCLEX Academy. Okay, so we're gonna have a review program in July. So I'll see you. Okay, so all right. So last one, Melissa. So I cannot catch up with all the comments. So we have Melissa Loretta, and she's from Philippines, and then also we have Mervin. Mervin is from New Zealand, so he's also our student right now in the online NCLEX Academy. We have big things coming up, in the next few weeks. We have some additions to our programs, and I'm so excited to share that with you later on. So we're gonna have new programs coming up to help students. Okay, but of course, my goal in the NCLEX preparation of students is not to overwhelm the students. My goal is always to make everything simple, fast, and easy. I'm not here to overwhelm you and really have like thousands of resources for you to prepare for the NCLEX. Everything has to be simple, fast, and easy. That is my goal because as a nursing student, as a nursing faculty as well, I know the struggles of students after graduation, how to compress all of the information and making sure that you remember all the concepts needed for the NCLEX. Okay, so for tonight, without further ado, okay, I'm gonna show you one picture. Okay, so this is one picture or photo that was sent to me by a nursing student. So this nursing student, our student right now in the online NCLEX Academy, she sent this photo and she's studying with the workbook. So with the workbook that comes with the program, so she bought that, and then she has her dog, sleeping while she's studying with the online NCLEX Academy. And so far, this student, her name is Riza. She's really very thankful that she graduated a long time ago, and for her to refresh all the concepts that she needs to prepare for the NCLEX. She's really very thankful that she's listening to the videos, to my lectures, okay, to refresh the content. So she's working also at the same time. So very nice picture, okay. So without further ado, again, as I've said, everyone, we're gonna start our first question for tonight. Are you ready for our first question? This is going to be a prioritization question, everyone. You know that every week we have prioritization and delegation questions. However, we tend to focus on one topic or subject or specialty. So for tonight, we're gonna have questions, okay? Especially for prioritization, this will be about pediatric nursing. So how good are you, everybody, in terms of pediatric nursing in the NCLEX? Okay. One tip to remember in the NCLEX, when it only says a client in the situation, a client, that means that is a patient who is from 18 to 65 years old. However, if the stem of the question refers to a child, then the age will be mentioned. So, like for example, a 10-year-old child, or a 5-year-old child, or a 3-year-old child, for example. Okay, it will be very specific. Okay, but again, in terms of prioritization, I always told you, do not you don't have to be distracted by the sex, or by the gender. So if it's a male or a female, it doesn't matter. And also be careful with the age as well. All right. So we're more focused on the clinical condition of the patient. All right, or the signs and symptoms in terms of prioritization. And again, in terms of prioritization, I've been telling you, you need to be familiar with the symptoms that are part of the condition. Okay, and if the symptoms are part of the condition and they are not life-threatening, then that is somehow not a priority patient. So we will learn about that tonight. Okay, so again, we have the story of 4 patients. As usual in the NCLEX, you always have to pick the first person that you're going to see. All right, and it's always possible that all these 4 patients are unstable, but you still have to choose the most unstable patient. Okay, so let's proceed, everybody. So I'm going to show you the picture. So everybody, are you ready? Can you say yes in the comment section, everyone? Okay, are you ready for our Facebook Live on prioritization? And also, just one request, please share this Facebook Live with your friends also, so that they will also benefit from the Facebook Live, everyone. Okay, so let's proceed, everybody. So this is the first question for tonight, everyone. Okay, so first question for tonight is going to be prioritization. So let's have it. All right, so the first question. All right, so this is a prioritization question referring to pediatric nursing. All right, so number 1, so let me read the question, everybody. Okay, all right, so the charge nurse in the pediatric unit receives the report from the outgoing nurse during the end of shift conference. Which of the following clients need to be checked first? So you have 4 pediatric clients in this situation. A, the 4-year-old child with acute glomerulonephritis who is manifesting periorbital edema and hematuria, which is blood in the urine. B, the 7-year-old child with cystic fibrosis who reports thick, purulent sputum and fatty stools. C, the 5-year-old child who has a presumptive diagnosis of diabetes mellitus due to increased urination. Or D, the 10-year-old child who recently came back after a magnetic resonance imaging or MRI procedure. So which one do you think will be the first client that you need to check first? So which of these 4 will you check first? Is it A, B, C, or D? So I would like you to really look at each client, the signs and symptoms, and find out which one requires prioritization. Okay, is it A, B, C, or D? So I would like to see your answers, everybody. Okay, so what will be your answer? A, B, C, or D? All right, do we have some answers already, everyone? Okay, I would like to see some answers. Okay, so some people said yes, A. Okay, let me see. Some people said yes, A. All right. So some people said B. Okay. All right. So let's see what others are going to say. All right. And can you give a rationale for your answer as well, so that we will be enlightened on what do you think is the priority in this question? Okay, what do you think? All right. So some people said letter D, some people said letter A, some said letter B. Okay. So we have one person who answered letter B. So Jewel Brian Reyes. Okay. So Jewel, can you please let us know what is your rationale why you answered letter B in this situation? Okay. So let us know. For those who answered letter A and D, can you also please let me know your rationale for the question? Okay, so now we will have to find out what's the answer to this question. The strategy that you're going to use for this question is this. You need to know, look at the condition, and then figure out, are these signs and symptoms part of the condition? And are they serious or life-threatening? Yes, maybe, but always remember you use the process of elimination, right? You have to look at all of the other options and always find out who is the most unstable patient. Use the process of elimination in this situation. Okay, so let's go to the answer to this question. Are you ready, everyone? Okay, so the answer to this question is going to be letter. All right, so the answer is going to be letter B, everyone. Letter B is the answer to this question. Okay, so why is letter B the answer to this question? You have to look at the question, everybody. Okay, so letter A, that is a child with acute glomerulonephritis. Always remember that acute glomerulonephritis is characterized by hematuria and periorbital edema. Those are manifestations of the condition. Okay, so we have to look at the other options. I know that you're thinking hematuria is serious, but remember, hematuria or blood in the urine is part of the manifestation. You have proteinuria, you have hypertension, you have periorbital edema. Am I right? So A is a possible answer. Let's not eliminate it right away. Okay, but then you have to look at letter C. Letter C, presumptive diagnosis of diabetes, we eliminate that. Why? Because there's no indication that it's a very serious condition, although you have increased urination there. Now, letter D, of course, that is not really that serious because that is a 10-year-old child coming back from an MRI. And we know that MRI is a non-invasive procedure. Okay, so but you have to look at letter B. Why? I know some of you are saying airway. Cystic fibrosis is characterized by increased mucus secretion. You know that. However, the mucus secretion in cystic fibrosis would be thick and whitish secretions. Now, is it normal for someone to have purulent sputum? Purulent sputum means what? Yellowish. It can indicate the presence of what? Infection. Okay, and we all know that patients or clients with cystic fibrosis are prone to develop what? Respiratory infection. I want to see that patient first. Why? Because that patient may be developing what? Infection. Okay, so that's why the answer is going to be letter what? Letter B. So that patient, letter B, requires probably immediately, you know what? Antibiotics. Okay, and infection can be life-threatening, definitely. So it is a priority in this situation. All right. What about if letter B we add fever? Of course, if you add fever as well in letter B, then that becomes the question really becomes more what? A real priority. So remember that. Okay. So this is a very important question, everyone. Remember that in the NCLEX, infection is a priority, and at the same time, airway, breathing, and circulation. But don't neglect infection, everyone. That's why letter B, thick, purulent sputum. So you really have to look at the word one by one, at the words one by one. Okay, so I know that you've seen cystic fibrosis, thick, purulent sputum, but you really have to look at the words one by one, everyone. Okay, and when it comes to prioritization question in the NCLEX, you learned one thing. What is my advice all the time? Slow down. Okay, don't rush. Okay, because these are questions that require your critical thinking. All right, so I hope you're learning something tonight. It's really important to know the manifestations of a disease so that you will know which one is normal, which one is part of the condition, and which manifestations are not part of the condition and are therefore a priority. Okay, so Ginger said the word report thick purulent sputum. Very good. Okay, so yeah, so that's why the answer is going to be letter B. Very good, everyone. So let's have the next question, everybody. So number 2 is another prioritization question, but I hope that, okay, in that question, you learned a principle. Okay, you learned a principle there. Letter A, you answered because you saw the word hematuria, like, oh, that's blood, that's serious. However, remember that it's a manifestation of acute glomerulonephritis, unless it says in the situation that the hematuria is massive, okay, accompanied by signs and symptoms wherein there's tachycardia, there's a decreased level of consciousness, then you can say letter A is unstable, okay, but it doesn't say that way, okay. So let's go to number 2. So number 2 again is all about a pediatric unit. Okay, so you have prioritization again in this question, everyone. So let me read this question. So the registered nurse performs walking rounds, okay, at the start of the morning shift in the pediatric unit. Which of the following clients require immediate intervention? A. The 3-year-old child with varicella who attempts to scratch the skin lesions. B. The 7-year-old child with pyloric stenosis who has abdominal distension and visible peristaltic waves. C. The 1-month-old infant with spina bifida who is sleeping in a supine position. Or D. The 6-year-old child with infectious mononucleosis who complains of throat pain. So who do you think is the priority in this situation? Okay, the 3-year-old child. So what I would like to find out from everyone is you have to put your rationale. Why did you answer that question? Okay, so is it A, B, C, or D in this question? Why is it letter B? Why is it letter A? Okay, so you have to give me your rationale, everyone. Okay, what's the answer? Okay, so spina bifida should be in a prone position. That's what Babita said. So we'll find out later on if that's really the answer in this situation. Okay, then you also have other people has been answering also other letters. Let me see. There's letter D. Okay, so let's proceed now to the answer, everyone. Okay, so let's have here. Okay, so let's dissect the question, everybody. Okay, so again, this is a question about the different clients that you see in the pediatric unit, everybody. Okay, so let's see the answer to this question. All right. Okay, so the answer to this question is going to be letter. Okay, are you all ready, everybody, with the answer to this question? Okay. All right. So Cheryl Tate said spina bifida should be a prone position. Okay. Let's see, everybody. You might be surprised with the answer, though. Okay. So the answer is going to be letter what? Correct. Letter C, everyone. Congratulations, guys. Okay. The answer is going to be letter C. Why? Because in spina bifida, the position should be a prone position. Okay, with legs abducted at the same time. The goal in spina bifida is, of course, to minimize pressure on the sac, because if there's pressure on the sac, what's going to happen is it can cause rupture of the sac, maybe, or even after that, possible neurological infection, and we don't want that to happen. And of course, it can have neurological effects. It can cause paralysis. So positioning is very important, with the legs abducted, at the same time prone position at all times, in order to prevent pressure on the sac. Now, looking at this question, you might be thinking, oh, letter A is the priority because that's a chickenpox infection. So when the child scratches the skin, that's going to cause infection or secondary infection. That's logical, letter A. But then when you look at all of this, letter C is the priority. Letter B, you see abdominal distension and visible peristaltic waves. However, abdominal distension and visible peristaltic waves are part of the condition of pyloric stenosis. Okay? All right. What about letter D? Throat pain is part of the manifestation of infectious mononucleosis. Okay? So, congratulations, everyone. You got the right answer for this question. Okay, let's move now to the next question, everybody. Are you ready for our delegation question, everyone? So if you're new here tonight, what you can do as well is we have lots of videos already that we have produced in the past few weeks. So you can visit our YouTube channel, okay, and Matus Nursing Review, and you can watch all the other sessions that we have. Okay, and this will help you a lot in your preparation for the NCLEX. But before anything else, I would just like to show you something because it arrived in the mail today. So our official T-shirt for Matus Nursing Review is here. So I'm really excited to wear this one of these days. Okay, so this is a very nice sweatshirt actually. And well, if you want to get one, just let me know. Okay, we can put that in the link. But it's a very nice shirt, everyone. I'm so excited. Okay, and it also comes in different colors. You know, so yeah. So we're actually giving one sweatshirt to the one who passed the NCLEX the last time, Kim. So she was interviewed here. So it looks good on me, I think, the blue one, right? So I like the blue color, so I think it looks good. Yes. So thank you, guys. All right. So now let's proceed to our next question. That would be your delegation question for tonight, everyone. Okay. Are you ready, everyone? I would like you to say yes in the comment section, everybody. Okay. All right. So let's have your delegation question. All right, so let's proceed to our delegation question for tonight. Okay, so, all right, so this question, okay, the licensed practical nurse receives the following client assignments from the registered nurse. Which assignment should be questioned? Okay, so this is a negative question. You're looking for the wrong one, right? So this is a negative question. So which one should the LPN question in terms of client assignment? A, recording the intake and output of a client admitted for chronic renal failure. B, applying hydrocolloid dressing on a client with venostasis ulcer on the right leg. C, flushing the client's portacath with normal saline at the end of shift. Or D, administering hydrocodone to a client with severe pain due to a left hip fracture. So which one here should the LPN question? Is it the recording the intake and the output? You have to really look at all of the options, everyone. Read the words carefully. Okay? So which one should the LPN question? Okay? Recording the intake and output of a client admitted for chronic renal failure. Okay? Be applying hydrocolloid dressing on a client with venostasis ulcer on the right leg. Letter C, flushing the portacath with normal saline at the end of shift. Or letter D, administering hydrocodone to a client with severe pain due to a left hip fracture. So remember, hydrocodone is a narcotic. Okay? Are LPNs allowed to administer hydrocodone to the patient? Okay? So some of you answered letter B, some of you answered letter C. Can you please give me the rationale, okay, why you answered letter A, B, C, or D? Can you let me know, everyone? Okay, so what do you think is the answer? Okay, so the answer to this question is going to be letter, drum roll, everybody. So let's see if you got the right answer, everyone. Okay, and this is a very common question in the NCLEX, to be honest with you. Okay, this one. So the answer is going to be letter, congratulate yourself, everybody. That would be letter C. Very good. So here you have your licensed practical nurse, okay, and letter A is not questionable because A is within the scope of practice of the LPN. The LPN can record intake and output, okay? Especially this patient is chronic renal failure. Letter B, applying hydrocolloid dressing, of course, that's possible. That's within the scope of practice of the LPN. And for letter B, it doesn't say anything that the patient is unstable, okay? And that's hydrocolloid dressing on a venostasis ulcer. Now, letter D, administering hydrocodone, of course, you know, just the word hydrocodone, you're like, oh, this is a narcotic. But hey, LPNs give hydrocodone or narcotic to patients, okay? So remember that. So that's within the scope of practice. So the answer is going to be letter C. So flushing the client's portacath with normal saline. That's the responsibility of the RN. So you have to go back and find out what is a portacat. A portacat is an easy access, okay, an easy access device, and it's connected to the central circulation. Okay, it's like a central venous line. So when it comes to central venous lines, the one responsible for that, especially the flushing and the maintaining the patency, that would be the responsibility of the registered nurse. Okay, so now this is always remember, be aware of your different central venous devices. So if you're not aware of what the portacat is, find out, Google online and see what's the picture of the portacat, because that is the responsibility of the RN in terms of maintaining and making sure that we maintain the patency of the portacat, everyone. So very good. So most of you actually answered letter C. So good. And then also there is one technique in this question. If you don't know what a portacat is, but using the process of elimination, to be honest with you, A, B, and D are all within your scope of practice. So that leaves you with letter C as the possible answer. So you should question that, because that's not your responsibility as an LPN. Very good. Okay. So last question for tonight, everyone. Are you ready for our last question? Okay. So, have you shared this Facebook Live yet, everyone? Can you please share this Facebook Live to your friends and to your timeline if you can? All right. So now let's proceed. So the last question is your most favorite item type in the NCLEX, and this will be the select all that apply. Okay. Select all that apply. So let's proceed. Okay. So the question is, the registered nurse, okay, is assigning clients to the licensed practical nurse and unlicensed assisted personnel in the medical surgical nursing unit. Which of the following items is or are appropriate delegation of tasks? Select all that apply. So which ones are correct? Delegations. Delegation of tasks. Is it A, instructing the UAP to check the mouth of a client with oral thrush? Letter B, requesting the LPN to remind the client to rinse the mouth after using a steroid inhaler. C, assigning the UAP to reposition the client who recently underwent a right knee arthroplasty. Letter D, asking the LPN to perform sterile suctioning of a client with open tracheostomy. And letter E, that would be instructing the UAP to measure the weight of a client who is scheduled for a prostatectomy. So letter E is a little bit obscure there or covered. So letter E is instructing the UAP to measure the weight of a client who is scheduled for a prostatectomy. Okay? So again, look at the options very carefully. If you cannot see letter E is measuring the weight of the client who is scheduled for a prostatectomy. And this is a select all that apply question, everyone. Okay, so slow down a little bit. So which ones are correct delegation of task? So I know some of you are still carefully looking at all of the options, everyone. Okay. All right, A, B, C, or D. So some of you answered B, some of you answered C. Okay, all right. So let's see, everybody. Okay, give your answer, everyone. Okay, everybody. All right, so are you going to include A, B, C, or D? I'm gonna give you the last 10 seconds, everybody. Put your answers last 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay, everybody. Okay, so I'm slowing down a little bit. Okay, all right. So let's go and dissect the question. Okay. All right. So this is a very challenging question for you guys. So when this comes out in the NCLEX, you just really have to slow down. But let's review very quickly. Okay. For UAP, you're not supposed to, especially registered nurses, you're not supposed to delegate anything that requires complex critical thinking. What you can delegate for the UAP are just simple routine tasks. Okay, anything to do with obtaining vital signs, maybe for stable patients. Okay, helping clients dress, bathe, and also eat or feeding. But you cannot delegate evaluation, assessment, and teaching. Remember that the acronym EAT, right? So for the LPN, all you have to really think is this: what are the scopes of practice of the scope of practice of the LPN? You know, what do LPNs do? So that's really very important. And then if it's within the scope of practice and it's an unstable patient, it cannot be delegated. Okay, you can only delegate as an RN if you know this patient, the task is within the scope of practice. That's the first letter S. Within the scope of practice, it's a stable patient. Okay, so SS, scope of practice, stable patient, and the last letter S is also the skill. So make sure that that's the person wherein you're delegating the task has the skill. So the scope, which is very important. If it's not within the scope of practice, never delegate. Okay, and then another S, is it a stable patient? Because if it's unstable, the RN should rather do it. Okay, and the last is the skill. Okay, so is this a new graduate nurse? Is this an experienced nurse? Okay, so remember that. So the answer to this question, everyone, will be letter, okay, okay, yes. So the answer is going to be letter B, letter D, and letter E. So most of you got the answers right. Can you please put your rational again? Because we want to learn from each other what you're thinking. Okay. So is letter B within the scope of practice? Yes. Now A is wrong. Why? Because letter A, to check the mouth of a client with oral thrush, that's an assessment. Especially if you use the word assess, then that's wrong. Okay? So instructing the UAP to check the mouth is not correct because it's an assessment and we don't want to do that. You know, we don't want to delegate that. And then also letter C is not included because a UAP is not supposed to reposition a client who recently underwent a right knee arthroplasty. Okay, so letter C is a patient that since it's a new surgery, then definitely the RN should be the one turning the patient for letter C. So with letter B, of course, the LPNs can remind clients to rinse the mouth. Okay, that's the LPN can do that definitely. Letter D, asking the LPN to perform sterile suctioning of a client with open trach, definitely yes. Okay, sterile procedures are part of the scope of practice of the LPN, so they can suction, they can apply sterile dressings on the wound as well. Foley catheterization, that's within the scope of practice of the LPN. And then letter E, measuring the weight of a client scheduled for prostatectomy is okay for a patient who for the UAP because letter E is a stable patient. It doesn't really indicate that letter E is unstable. So UAP can measure the height and the weight of a client. So remember that. Okay, so bravo to me. Okay, very good. Okay, I better show this comment because Marie Andre Vincent said bravo to me. So congratulations, you got the right answer, Marie. Okay, so congratulations to those who got the correct answer, everyone, tonight. Wow. Thank you very much, everybody. But again, before I end for tonight, just reminding you that we have the online NCLEX Academy. We have a live webinar comprehensive for those who wants to refresh their content. That's going to start in July 18th to September 26th, every Saturday from 8 to 3 p.m. It's a live webinar. It's a comprehensive. It's not 8 days, but actually 10 days we extended. So every Saturday. And then we also have our ongoing continuous class every Tuesday from 7 to 10:30 p.m. That would be the 12-week Fast Track NCLEX review. So you have two choices. So if you want the comprehensive or the Fast Track. Okay? So, yeah. So thank you very much, everybody. And again, the goal of our program is always to make everything simple, fast, and easy. Okay? We don't want to make things complicated. So that's the most important message that I have to all the students, that my goal is for you to understand concepts in a simple, fast, and easy approach. That's the most important thing. And that's what students like with my video lectures because my approach is very direct to the point. Okay, and then I emphasize what are the concepts that you really need to know in the NCLEX. But of course, lastly, again, you know that I have a book published in Amazon. Of course, it's nursing school wrapped into one book, and that would be Simple, Fast, and Easy NCLEX Review. So far, I'm not sure. How did you find the book, everyone? Is it easy to read? Is it simple to read? So you can put that in the comment section before we end. So who has this book, everybody? Actually, here is the book. Okay, so here is a book, and I will have a book signing soon. So if you want to have a signed copy of my book, so I'll announce the event for that. So I'll be signing books, everybody. So this is the book. Okay, so thank you very much, everybody, and I hope that you stay safe. Okay, we still have the coronavirus situation up to this time. So again, thank you, Jericho. You're there. Thank you, Jericho. I think you're new. Okay. So Manuska also, Manuska, I hope you're feeling better. You're doing okay. All right. So we also have Denise Germain also. So I hope you learned something, everybody, tonight. Okay. So workbook with the lecture is good. Thank you, Pratixa. Thank you very much. Okay. So, and Hilda also said that it's really very helpful, the book. So thank you very much, everybody. So tell your friends about it. So again, okay, our program, our goal in the Matus Nursing Review Online NCLEX Academy is to make everything simple, fast, and easy. Thank you very much, everyone, and have a good night.